yes, somebody has generously provided you guys with these mask setups, and for use, if you guys encounter the situation in real life, which you guys already have, there's just a few anatomical differences, both with these masks and with where you access things on the animal and what's different. You know, we don't do mouth to mouth, we do mouth to snout, and some of those aspects of things. You are doing more of a nasal placement of the mask. If you can place their whole muzzle in, then we will do the whole muzzle if they'll tolerate it. A cat, you might actually be better off with this one because you can kind of almost stick their whole head in it. Best place to get your pulse is your femoral artery, and you just palm the dog, wrap your hands around. For me, with my size hands, I'm a size small glove. I can, on small dogs, my fingers land at almost exactly where I want to be. On a larger dog, I kind of have to put my palm up closer to the knee and wrap around, and you can feel a pulse. So in the very small ones, you can sometimes actually almost wrap your hands completely around and compress this way, or sometimes I'll actually compress and you kind of wrap your whole palm and compress this way. People say when you're solo, you can actually wrap your arms around a small patient and do it this way, but I've always compressed when they're in lateral recumbency. And then if you get a larger dog, then you do the same thing. You kind of tuck your hand into that armpit and you're going to compress this way. Quite often with ferrets, gerbils, hamsters, you end up sticking their whole face in here. Or if you've got a gerbil that's breathing, just stick the whole gerbil in that tank. You can actually stick, I mean, if we have to support one, or if we have to anesthetize something small like that, you just stick their whole body in a cone and they kind of look at the walls. But you can actually stick their whole body in here if they're breathing and seem like they're doing okay and just need some oxygen support. Reptiles are difficult. Reptiles hold their breath really well, so just do the best you can. The other aspect is that if you have an animal that's actually acting aggressive, you can actually make a gauze muzzle.
We've had some fatalities, which happens, and most of the time it's fish, small pets, the hamsters, rabbits, and gerbils. They don't fare very well in the smoky environment because they're up higher, usually sitting on a cabinet. So.
And if you've got ferrets or reptiles, pillowcase works great. Yeah. Even for a cat or a small dog. I mean, anything that you can contain them in to safely get them out of the building without them hurting you. Because when they're scared, they're going to go hide if they're not sure what's going on. We'd like to think they'd come running to us. No, they go find the nearest thing to hide under. So.
I think the last animal we had that was injured from a fire was after the Oak Knoll fire. About 2 days after somebody presented a cat that had fairly significant burns, first, second-degree burns on its feet and face, cinch tear, the whole 9 yards, and it was hurting, you could tell. And so we sent it to Medford to the ER, or
yeah.
I can't remember what locally.
Complete recovery, I believe. I was reunited with his owners.
Oh, good.
And then I had some come into my office with general malaise after the fact that owners, I think the owners actually, they couldn't find the pets, and then they did show up, but they were owners that were actually able to go and kind of look for them, or they showed up somehow. I had some with general malaise, but yeah, that cat did succeed.
Oh, good.
Yeah.
They'll figure it out and they'll get out by themselves.
Yeah.
Very seldom do they stay in the structure.
Yeah.
The gerbil, the hamster, the guinea pig, and it's just trying to convince them that once you're out, you don't go back in, you stay out, and you let us know where that animal or that pet is, and we'll do our best within reason to get that animal out for them. But they're absolutely not allowed to return into that structure once they get out. That's not okay. And that's probably our biggest concern. And then the elderly. And it kind of comes back the way where the kids are the same. That's their family, and so.
Yeah.
And they need to convince them that that's our job to do it safely rather than their job.